Hi, everyone. Welcome. Shomer Collective was designed specifically to talk about death Jewishly, recognizing that too many of us and people in our communities wind up in crisis or a place we wish we wouldn't wind up because we haven't done enough to talk about or plan for the reality of death. And we knew that there was a lot of Jewish wisdom on this topic that we needed to bring back into our conversations, recognizing that when we talk about life, talking about the fact that it's finite can help us to get more out of life. You can read about our mission. It's really to normalize talking about death and dying Jewishly. And our vision is a world in which we have done the work to talk about death and dying on the regular, early and often. The word shomer in Hebrew means guard. The security guard at the front entrance to a building in modern Hebrew is called a shomer. And in Jewish tradition, the shomer is the person who sits with the deceased from the time of death until burial. In olden days, as the kids say, literally to guard the body from anything that might seek to disturb the peace. And today, we continue to do this. Often, members of the Chevra Kadisha, the Sacred Burial Society, will take turns sitting shmirah, sitting in the role of shomer as a guard with the body. So the shomer is providing accompaniment, sacred accompaniment in human form to that soul as it begins its journey. And Shomer Collective's work is designed to leverage Jewish wisdom to accompany you on this journey of living more deeply into life, recognizing how life is finite, recognizing the value of talking about and planning for end of life. The majority of Americans, the majority of people in this country say it's important to talk about what we want for end of life, yet only a minority of us have actually done the work of having a conversation and creating a plan. And this is the work of where we are today, right? Tomorrow's never guaranteed. We're recognizing that reality. God willing, we should live to be 120 like the prophet Moses. But what does it look like to live in a state of preparedness? The next layer is the transition. How do we make meaning Jewishly of that transition between life and death? Could be bedside prayers, could be the ritual washing following death. What do we do Jewishly in that space, the transition between life and death? And the third level is mourning. What does it look like to grieve Jewishly? Today's program is the second in a three-part series that we're offering this season on medical aid in dying. Last month, we spoke with former Manhattan Borough President Ruth Messenger to understand one Jewish family's experience choosing medical aid in dying. Her family traveled to Europe to make it happen as they were dealing with a dementia diagnosis. As you know, this option is becoming more widely available in the US, with a growing number of states legalizing it each year. And our question is, how might we understand this in light of Jewish ideas? And now I just want to take a minute to ground us in place and time before we enter the heart of our conversation. We're coming up on the holiday of Purim next week, the holiday in which we read the book of Esther. And summarizing the book of Esther very simply, it tells the story of a Jewish queen in Persia who, with the help of her cousin or uncle Mordecai, risks her life to thwart a plot by the royal advisor Haman to annihilate the Jewish people, resulting in the salvation of the Jewish people and the establishment of this holiday of Purim to celebrate that. For the end of the story in the book of Esther, we read in chapter 9, Mordecai sends dispatches to the Jews throughout all of the provinces of the kingdom, near and far, instructing them to celebrate the evening of the 14th and the 15th of the month of Adar next week, every year, the same days on which this community of Jews enjoyed relief from their enemies, has been turned from a day of grief into one of joy. They were to observe, this is from the book of Esther, these days of feasting and merrymaking and an occasion to send gifts to one another and presents to the poor. This idea of transformation of grief and mourning into joy reminds me of the ways in which we experience things like anniversaries and birthdays and holidays after the death of someone we loved long after they've died. We may still experience the grief through sadness, but sometimes we have the ability to use the memories that we have of them to bring us a little bit of happiness. Right? I miss my grandma Molly, who died in this season in many years past, but thinking about her brings me a smile when I recall all of the special things that we did together. The work that we do when we're alive to create love and relationships helps us to experience the blessing of our memories when we remember the people who are no longer alive. So, this work we're doing together to talk about death Jewishly, while it can be hard, is meant to make our lives just a bit better. Knowing our wishes and having them honored is one way to do that. Today, we're honored to host my friend and teacher, Rabbi Shlomo Brody of the organization Ematai, to talk with us about traditional Jewish law's view on the topic. Thank you.
Thank you so much, Rabbi Melanie, for this kind invitation and for all that you do in Shomer. I'm aware of the fact that I'm a part of a series and there are other perspectives out there, and certainly I welcome the fact that we have the opportunity for people to learn from different perspectives on on a political issue, which is much more than just a political issue. And as you mentioned, New York State has legalized medical assistance in dying. And my organization, Ematai, we lobbied against New York State against the passing of this bill. Nevertheless, the option exists. It's very real. It's in 13 states now, plus Washington, D.C. There are bills in the UK and France and Canada and other places where this phenomenon exists. And therefore, Jews who live in democratic societies have choices to be made. And here I'm going to give you one Jew's perspective. I'm not saying it's the Jewish perspective. I'm giving you one Jew's perspective. I am an Orthodox rabbi, although what I'm going to argue today is that I don't think this per se has anything to do with my orthodoxy. But if you look in the Canadian example, which again is not our focus, but in the Canadian example, which it's now over 5% of all deaths in Canada, it's been very interesting that opposition to MAiD, what's called euthanasia there, is both from the conservatives and the liberals, meaning on a political level. Many human rights advocates are very against this. They think it's ultimately going to be used against people who are less access to health care, who are underprivileged in one form or another, for minority groups, whatever it might be. And so I don't think this is a denomination issue per se. I don't think this is a classic left-right type of divide. I think ultimately we have here a deep moral question, which is, what do we think about facilitating on a societal level the opportunity for someone to say at this stage, I want my life to be over. Now, I want to be very clear. There's real suffering that goes on at end of life with terminal illness. And as Jews, we need to recognize that suffering. We have the mitzvah of V'ahavta l'reacha kamocha, of love your neighbor as you love yourself, which is the basis for visiting the ill, which is the basis for many things about taking care of the ill. And that's an obligation which is on all of us. All of us as Jews, as human beings, have to recognize the suffering of others and do what we can within our moral conscience, right, to help alleviate that suffering. Right? That is just a general obligation that is upon all of us. And certainly, I'm not really interested on a personal level in asking on an individual level as much as a societal level about what it is that we believe should be provided for and given on a societal level to those in this very difficult situation. I think classic Jewish law has been built around an idea. You certainly have guardianship over one's body, but there are limits. There are limits to what we say that one does to their own body and what one does to others. This comes already from the book of Genesis. This is after the great flood, the great deluge, in which we're talked about the idea that we don't kill other people. All humans were created in the image of God. This is an important principle. And from here, though, the sages in the Talmud, in the tractate Bava Kama, learn that it's not just that we don't kill other people, we don't harm ourselves as well. Right? Self-inflicted harm is a deep prohibition. And it's not just a prohibition applies to Jews, it's seen as being a prohibition which applies to all human beings as one of the 7 Noahide laws. And what's interesting is that in the 18th century, or really 19th century, Rabbi Tzvi Yaakov Mecklenburg, in his commentary to this verse, made the point already recognizing that, there's some types of killing which is obviously done out of malicious, evil intentions. But there are some types of killing in which you might even have the victim's consent, and it's perceived to be done for the benefit of this person as well. And nonetheless, this is seen as being absolutely prohibited. Okay? And the question is sort of why? I mean, why is this such a strong stance? Now, it's not because of a lack of sensitivity to pain and suffering, or at least in my mind, it's not because of that. And we have this idea, it's a beautiful image of the sages, that every human being is like a light unto this world. When the candle is flickering, don't be the one to put out the flickering candle. Right? It's not our job to put out the flickering candle. It's a beautiful image in many ways. And I think that this comes from an idea which says that we recognize the fact, though, that sometimes it would be better for a person to die. Here's a big source from the beginning of the 20th century, just to give you a sense of this. And it's Rabbi Epstein, author of the Aruch HaShulchan, and he writes and says, there are times when sometimes we should pray for someone to die. Sometimes death is preferable to life, and in those cases, we should pray for someone to die. It's actually interesting. The first question I got as a young rabbi was from a student of mine, and he comes up to me and tells me that his great uncle is dying from cancer, and he wants to know how to pray for him. Isn't that a great first question to get as a rabbi? Like such a deep question, whatever it is. It was great. There's always one problem. I didn't know the answer. That's really deep, and you realize like all those rabbinic training hasn't unnecessarily prepared me for real life right now. And what I actually told him at the time was, an answer I was given to someone else, is that there are definitely times when we say to God, have mercy. Have mercy. Like, God, have mercy on this person. And God's going to figure out what this mercy looks like. Because I do think we recognize that there are times when the suffering is too great and the illness is too terminal, that we're not really praying. If we want to be realistic and be real, we have to pray for, at this point, for God to have mercy on this person. So I think that's a theological principle which we're comfortable with. And I'm also very thankful for the fact that we live in an era in which we have a lot of great pain medication. And pain medication is something which should always be used at every stage of a person's healthcare journey and treatment when they need it. Palliative care is something which is crucial for always to be offered. I cannot tell you how many times when we at Ematai get consults from families and they haven't been offered proper palliative care, whether it's pain medicine or other types of palliative care. And it's tragic in my mind. And here's a statement from the lead ethicist one of the prominent ethicists in Israel, who talks about the fact that pain medicine just has to be given. You have to do this, even when they're in the eras when there was a thought that it might hasten a person's death. Medicine doesn't work that way. Morphine doesn't work this way. But when it was thought this was the case, we still give people pain medication, because pain is something that has to be dealt with. You cannot ignore the pain. Okay? You cannot ignore the pain. And this, by the way, includes what's known as palliative sedation, or what's known as proportionate sedation today, in which we might give person enough palliative care that they will be sedated until nature takes its course, which I think is also acceptable. The intent there is to address a person's pain. And we're not doing an act which is directly causing them to die. And we're trying to not be the person that put out that candle. And the question is why, if we care so much about the pain, then why is it that we don't want to take the next step in order to allow someone then to just actively cause themselves to die? I think much of the push today for the legalization of medical assistance in dying, whether it's in the form of euthanasia or whether it's in the form of physician-assisted suicide, wherever you put under the rubric of MAiD, comes from a certain understanding of liberty and the right to die. And here's a classic Supreme Court case. This is a Canadian case, but it's come up in the American context as well. Now, I want to distinguish here the right to die versus the right to refuse. The right to refuse is an idea which says you have the right to refuse, do everything. What does that mean, even do everything? There are times when we say it's not going to be helpful, and a subjective level of understanding of extending life in a meaningful way at this point. And that being the case, you have the right to say, I don't want certain medical interventions anymore. This is a very nice quote from Rabbi Dr. Moshe David Tendler, who's a very important bioethicist at Yeshiva University, who talks about the fact that Judaism is concerned about the quality of life, the mitigation of pain, and the cure of illness wherever possible. And if no remission can be achieved, nature may allow it to take its course. To prolong life is a mitzvah, is a commandment. To prolong dying is not. We care about pain management. We believe in the idea that you don't always have to do another intervention to extend the painful dying process. And yet there's a notion that says, but there at some point we don't go so far. And part of the motivation in the West today comes from a belief in autonomy and a belief in sort of a sense of saying that liberty means, in my circumstance, that I should have the ability to decide what happens to me, including not just the right to refuse, but also the right to die. I brought here from one of the earlier cases of writings of six great philosophers when this issue first came up in Oregon and other places in the United States, who more or less invoked Planned Parenthood v. Casey and Roe v. Wade, discussions about abortion, my body, my choice, and said, listen, if we say you can withhold care, you can withdraw care, what's the difference? We're respecting the patient's wish. And all we're asking for is the right to a doctor who's willing to help us to die. And there's a lot of pushback from this. And this pushback, once again, is not coming from, sort of right-wing, conservative, orthodox, whatever it might be, types of circles, but others just who, for rational reasons, maybe Jewish reasons, rational reasons, whatever it might be, don't think this is right. And a number of the arguments come from, and I very much respect this, saying that this is not what medicine is about. The medical community is not about actively causing someone to die. We have a mitzvah. A mitzvah is v'rapo yirapeh, to heal. To care, we all have an obligation to care. To heal, though, is the obligation of the doctor, who has the opportunity to intervene in someone else's body, which is not something we normally would do, in order to try to heal them. And sometimes we can no longer heal them. So we try to heal them partly, or try to heal their pain, or at least address their pain. But the job of doctors is not to enter into the position of actually causing someone actively to die. Now, many have said, well, what's the difference between that and what you might call withdrawing care to the point where it's going to cause someone to die soon afterwards? And in fact, this is one of the arguments that was made by these philosophers beforehand, where they said, listen, if we already allow to quote unquote pull the plug, so if that's the case and the person's going to die soon afterwards, what's the difference between that and active euthanasia? And I think there are a number of different responses to this, but I think that ultimately those who support the idea of withdrawing intervention believe that this is a basic statement which states we're withdrawing this medical intervention because that intervention is no longer accomplishing the goal that's meant to do. And so the same way that we would say, okay, we're going to forego an intervention of radiation or chemo, whatever it might be, when it's no longer going to do the job it's supposed to do, we can withdraw those interventions as well. But here, the act of assuming that you're allowing some form of medical assistance in dying is an act which says that no, you're going to facilitate the active dying of the patient and cause that to happen. And we don't want that to happen from a physician's point of view. We don't want this to become what medicine is. And I think that there's a certain element here of saying that the medical profession, and not just the medical profession, but the idea of healing is about trying to do what we can to better a person's condition, but to stop at a certain point and saying, we're not going to go to this level. With all the pain medication we'll provide, we'll do lots also of other things, but at the point in which we're saying we're not going to actively come and cause this person to die. One of those who've made this argument is a man by the name of Leon Kass. But when he wrote this in the 90s, he was just writing this from his general perspective and talked about the idea that we must care for the dying, not make them dead. And part of what it means to be a human and a doctor is to embrace, not because we like it, but to accept mortality and to confront it, but not by actually actively causing someone to die. And what's interesting to me is that Lee Cass makes the argument to say that part of the reason why we do this is then we'll stay focused. And our focus should be about company and care and doing everything we can in order to keep people comfortable at these moments. But what's interesting to me is that he was making this argument on a rational level or a perspective of a doctor. But in the 90s, when this issue really became highlighted in the United States, this wasn't actually a denominational divide. If you look in the discussion from different denominations, you'll see a response that came out of the Reform movement on this issue, in which the Reform movement, I think, very beautifully explains, listen, we as Reform Jews don't consider ourselves bound to traditional texts in the same way as others do, and we believe we can depart from tradition when we think it's necessary to secure an essential religious or moral value. But in this case, we fail to see why we should do so. We see no good reason to abandon the Jewish traditional Jewish teaching on this topic. If the doctrine of life's essential holiness means anything at all, it means that we must stand in reverence before the very fact of life, the gift of God that renders us human. And this reverence does not diminish as human strength declines, for the dying person still possesses life, a life stamped indelibly with the image of God until the moment of death. And then they go on to say that we recognize pain and suffering. It's a serious issue. We have to have a lot of compassion. But at the end of the day, we don't think this is a reason why a human should take their own lives or have someone else do this. Every moment of life, we stand before God and take the strength that we have, and we have to confront this life in this world in this way. And then they go on to say also, we just are very concerned about all this talk about quality of life and how this can be abused. And here I'll mention one other point, which I've purposely avoided, though, throughout the conversation, which is to say the slippery slope. There's a lot of concern about MAiD, especially in the Canadian example, where that MAiD is going to be something which, once it's allowed, all the safeguards are going to fall apart. And soon afterwards, we're going to say it's only for people that have a terminal illness, then it'll be expanded to others, and it'll be, broadened out in different ways. And I think there's a lot of truth to that. And you look at the Canadian example, I actually think you see that. In 2016, when they legalized MAiD in Canada, there was all sorts of rules of terminal illness and 6 months. And over time, it's become greatly expanded. And it could be that will happen in the United States as well, or it might not. I don't know. I am concerned about the slippery slope, but that's not really my main focus. I don't think this is the job of doctors. I don't think this is the job of human beings. I think that we need to have a tremendous amount of sympathy and care for people. And part of what it means to be a human being is to confront that mortality and confront it for ourselves and for others, and to help people in these moments. And that is what care is, and to heal the best we can, but not to go to the point in which we act as God does and makes those decisions about death and dying, whether for ourselves or for others. And now I recognize the fact that you might say, listen, Rabbi Brody, I totally get it. You're not into this. Don't do it. But why are you stopping me from doing this? Right? And that's sort of one of the arguments that I think that, has come up in general when it comes to liberty for many different issues. And, you can make this argument about a lot of issues. And there are a lot of laws that sometimes, although we've moved away from this in the West, for better and for worse, when it comes to, morally driven laws, where it's sort of like the harm principle. And the harm principle says, listen, if it's not causing harm to someone else, don't impinge upon my liberty. But, here, friends, it's an interesting question. Does the harm principle apply? Right? When you might ask and say, well, this is actually causing someone to die. So, it's hard not to invoke here the harm principle here as well. But I think the more fundamental argument people say is, well, it's my body, my choice. If I don't want to, if I want to do this, that's my choice. It's not your decision. And here, listen, there's no, whether it's physician assisted or otherwise, people have sometimes chosen out of pain and suffering, again, full sympathy, to end their lives because of the suffering they've had for many years. I don't want this to be something that society does. I don't want this to be something which society does, which society transforms end-of-life care to include this as the option. We live in a world in which we've lost a little bit of perspective on the sanctity of life and the holiness of life and the holiness of the obligation to help others. And putting this out there, I think, is going to harm that type of ethos, let alone the slippery slope type of concerns here. And so, this is sort of my basic argument, which is to say that, yes, we need to care for everyone. V'ahavta l'recha kamocha is a theological principle. Whether you like the person or don't like the person, we are all created in the image of God. We should have sympathy. We should have empathy. We should do what we can to alleviate pain, including, by the way, changing the way we pray. I am willing to acknowledge the fact that sometimes death is better than life, which is a hard thing to say, but sometimes that's true. And of course, there are always going to be hard cases. And I'm willing, particularly in those hard cases, to allow people to forego and even sometimes encourage people to forego interventions that are going to just extend a painful dying process. But I don't want to be at the point where on an individual level, but certainly on a societal level, we've turned the choice or the options into, at this point, to just ending that life. I suspect that MAiD will continue to spread in different places. And then it's going to become the obligation, I think, of our community to make sure that we are providing people with the option to stay alive and to confront their illness in ways in which we can address their pain, but appreciate every moment that we can for people. I'll end with I think, a very important statement, which is taught in Ethics of Our Fathers, Pirkei Avot, and which we're taught that Yafeh Sha'ah Achat B'olam Hazeh, that precious is every moment in this world, in a moment when you can do tshuva u'masim tovim. You can do repentance, you can do good deeds, you have to talk to God, you can talk to your loved ones. These are all very precious moments. Now, there are times, though, when people are suffering, and they can't even do that anymore. And at that point, I understand we might want to forego any form of medical interventions to extend this dying process. But until we get to that point, I think we should be trying to help people to live and to live in the best way that they can, and then allow nature take its course when we get to that point.
Yeah, thank you so much, Rabbi Brody. We are blessed to have your voice in this conversation. I just want to clarify for some of the folks asking for clarity in the chat. Today's program was designed and advertised to present the traditional Jewish law view on this topic. We invited an Orthodox rabbi to present that, knowing the variety of opinions of a variety of rabbis and movements out there. Last month, we presented the story of one liberal Jewish family's choice. And next month, I will be holding space for us to dive a little bit more deeply into these nuances. And I'll say that my teacher, Rabbi Richard Address, who is a figure in the Reform movement and hosts a podcast and a website called Jewish Sacred Aging, likes to say that the Reform movement's opinion, even with its permission, is no but. Right? No, we don't really want you to do this, but recognizing that many families are faced with challenged decisions between suffering and extending life. Here's how we might understand it from a liberal perspective. Right? It is the case that Judaism holds life above all else, right? We should choose life, we're taught in the book of Deuteronomy. And with advances in medical science and the ability to live longer and therefore perhaps to suffer longer, we face these difficult questions. But Rabbi Brody, here's one question for you. Can you clarify the Jewish legal perspective on removing nutritional intervention, particularly when all other forms of treatment or medication have ended? The patient has been sedated with strong medication, and how do we deal from a traditional halachic Jewish law perspective with removing a feeding tube?
Yeah, sure. It's a great question. So this is a matter of great live debate. We always handle these issues on a case-by-case level, right? So I'm just going to lay out some general perspectives on it, but we always try to address these issues on a case-by-case level. So first of all, it's important for people to understand that artificial nutrition and hydration can't always be administered. It's just on a physical level. Sometimes it's medically contraindicated. The veins can't handle it, and you can try inserting what's known as a PEG tube into the stomach, and it causes all sorts of complications. So sometimes this is not an option, right? But when it comes to even when it is an option, there are a couple of very prominent Orthodox rabbis, particularly affiliated with Yeshiva University right now, who think that artificial nutrition and hydration is no different than any other medical intervention. And therefore, once the bag runs out of supply, it doesn't have to be restarted. The same way you might say of, let's say, pressors, that govern vasopressors, that govern blood pressure medicine. I think most people in the Orthodox world, at least, though, see this as a form of a natural necessity that we should always provide, with the thought being we should allow the underlying disease to cause the person to die and not the lack of nutrition and hydration. But as many of you know, people who are in the dying process, the amount of caloric intake they need at that point can be quite minimal. And sometimes there are points where we're not going to give them, let's say, a full amount of artificial nutrition hydration, but just sort of minimal types of water, maybe low sugar, glucose, whatever it might be. And like I said, every case is a little bit different on a case-by-case level. With the idea, once again, being that we're not trying to prevent nature from taking its course, as much as we just don't want to be the cause of someone immediately to die. And when you remove artificial nutrition and hydration, of course, the person doesn't die right away. And that's part of the debate on that type of issue.
Thanks. That's helpful. I received a question directly to me. At death, we Jews say, Baruch Dayan HaEmet, blessed be God, the true judge. How do you think this idea translates in this context of MAiD? Do we think that God is the true judge, is the question being asked?
Well, I mean, that's a great question. It's a great way of formulating it in the following sense. Part of the idea behind Baruch Dayan HaEmet, from this traditional blessing, is the acceptance of the will of God, and that God is ultimately the one who decides whether a person lives or dies. And by the way, which is just something in general to always keep in mind, which I always stress to families when I'm consulting with them. Like, we can all have all sorts of ideas of interventions we should do or don't do, and we think it's going to work or not work, and something else totally different happens because it's not totally in our hands. And I think part of what the movement to legalize MAiD is to take control, and to have this type of be able to say when a person dies. Now, it is interesting to know, and I want to mention this to people, particularly in the United States, but this is true in Canada as well. Many people who request a prescription, let's say, for physician-assisted suicide, or even fill the request, right? Get the medicine, don't actually use it. In different places, it could be 30%, 50%, whatever it might be. They want to hold on to that option in case, they feel like it's gotten too much or the pain has gotten too great, whatever it might be, and they don't actually utilize it. And I think that part of that really stems from not just because of wanting to be in control, but there's a fear of being in massive amount of pain and not be able to control that. And I totally, totally respect the fear of that pain. But I think that we have palliative measures today that can greatly help. I don't want to say totally avoid that, but minimize that amount of pain. And so that's something which I think is something we should be totally offering to people, but leaving ultimately the moment of death up to God. And that, I think, is part of what Baruch Dayan HaEmet means. It's a theological principle which says that these are ultimately decisions that should be in the hands of God.
So we've had your colleague, Rabbi Jason Weiner, in conversation in past Shomer Collective programs. Some of you may be familiar with his work at Cedar Sinai in LA and his books about decision-making in a hospital setting. And he helped us to understand in a previous teaching that we might look at things like DNR, do not resuscitate, and call it AND, allow natural death to happen. It sounds to me like the more permissive or broader Orthodox perspective on this big picture is allowing natural death to happen is different than choosing to actively take steps to make it happen. So if it helps anyone to understand a do not resuscitate order in different language as allow natural death to happen, I just wanted to share that since I know that the two of you do work together. Yeah.
Absolutely. It's important nomenclature. And I fully respect, we're trying to, it would be very easy if I would be of the position which says you always have to do everything to extend every moment of life, no matter what pain and suffering is going on, which is certainly an idea that's been out there in Orthodox circles and other circles as well. Less so today in the West, but certainly, 50 years ago, that would be now be an uncommon position for people to take. But that's not actually my understanding of the tradition. And part of my understanding where it gets complicated is I recognize we should have a certain amount of, I think you might call it even modesty in terms of recognizing you can't always extend life. And nor should we do that, especially when a person's saying, I don't want this. It's that moment, though, of causing a moment of death, which I think is when we have to stand back and say
Yeah.
this remains the work of God. And this certainly is not the role of physicians where we want them to be focused on healing.
So a related question, having a DNR for a person, from your religious perspective, how does that work?
So DNR is just an order which says that I don't want a certain type of intervention known as resuscitation or CPR. And there are times when CPR should, of course, be administered. And but there are times when a person, particularly when they're terminally ill, let alone suffering, but certainly terminally ill, that DNR, excuse me, resuscitation, CPR, is just not a very effective intervention. We see on television, CPR always works. And not only does it work, but the actor's hair is always in perfect place. It's amazing, right? In other words, they're always looking good, right? And there's actually been studies that have shown that on TV, about 80% of the time, CPR works. And the reality, though, unfortunately, is that particularly when people are terminally ill and they're very frail and they have a lot of factors, and the heart's sort of the last thing to go in this respect, it's just not very effective intervention and can be quite painful. And why, I don't want to die with painful chest compressions that can't help me. So that's when we have to have a proper, medical assessment. And there are certainly times when a DNR is very appropriate. Some people are a little bit weary that a DNR order can be turned into what's known as a DNT, do not treat, meaning it applies to other types of interventions, or even, God forbid, a DNC, do not care. And of course, you have to have a proper types of conversations with people, but there are certainly times when I think DNR is appropriate, and not only appropriate, but should be done.
Thanks. A question from the chat. Are there more liberal chuvot, rabbinic answers to these questions from modern and open Orthodox rabbis?
A good question. So I think that in the conservative reform movement, as you mentioned, there are definitely some trends there. Although, as you stated, I mean, if you look at, let's say, Rabbi Elliot Dorff, who lives in California, where they've, legalized medical assistance in dying, he has like it's a permissive tshuva, but it's in very limited cases when he feels that palliative medicine just isn't able to help people. And I guess you'll discuss that the next time. I'm not aware of open Orthodox or more liberal Orthodox responses that have a different perspective on this. And I think it's actually telling in some ways that that's just not where we want to see medicine go.
Great. So a question sent to me privately, but I think it relates to some of the conversation going on in the chat. There was a comment in the open chat earlier about concerns with MAiD as it relates to folks living with mental illness. And so the question in the chat, thank you, Rabbi Brody, the questioner says, I'm curious about your perspective on Jewish law's approach to disability and autonomy in relation to MAiD. So I know that you have been deeply, involved in changes to the laws in places like New York to be able to protect the most vulnerable. Might you say a few words about cases of mental illness and disability, which we know are a little different in some places like Canada than in the US?
Well, I'd say the following, that I do have, and again, wasn't trying to stress the slippery slope type of argument. And yet I do have grave concerns that people that are more vulnerable, particularly in the healthcare space, when it comes to mental illness or disabilities, we're not the same, right? The different types of issues here might get, some form of pressure in this realm. That's been a very big concern in Canada. I do think it's better to have the way the American system of physician-assisted suicide MAiD version than in the Canadian version, in part for this. I'm concerned that we're going to have a situation where people that have different ailments that can be addressed in much more productive and helpful ways are going to end up taking this type of course because it's sort of the easier course, whether for them or particularly for society. And that's what you've seen in the Canadian pushback, but also in the New York and other pushback, where there are a number of sort of human rights groups and advocates that are very concerned about, where this is going. So the premise is autonomy. If you have people that can't have the full autonomy, then how can you offer it to them? This is also a big issue, of course, with dementia, and you want to have an advance orders, right? This, and Quebec's going in that direction. But on a societal level, if you're really going to be promoting autonomy, how can you do it if you don't think the person is really giving proper consent? I find it now, right now, the law, we've tried to make it very clear that it has to be done only through patient request. And I certainly hope that remains that way.
Great, thank you. Um, a question on the theological side. When you mention the slippery slope, retired doctor says, it seems to me the slippery slope, saying the moment of death is in God's hands. How does that work when we see things like young children getting cancer?
Well, we're not going to be able to solve theodicy, right? The justification of evil in this world, right, through this issue. I mean, those issues are going to exist no matter what we do in society. I mean, I have all sorts of questions. I live in Israel, and I live in a city which has had 35 deaths related to this war, right? So I got a lot of, we all have our questions and whatnot on this issue. We're not going to be able to solve that. That's a much broader question. There's a more, I think, human question that we have responsibility to act for is how do we want our society to look like, and how do we want to deal with those types of cases? Those are tragic cases, but whether it's a 5-year-old or a 50-year-old, right, there's a certain amount of tragedy here, and I think that our role as humans is to care and to heal the best we can, but not to do in a way in which we're causing someone to die and make that ultimate decision.
Thanks. We have time for another couple of questions. Here's one. How does MAiD interface with times when care is rationed, such as during COVID?
So, I mean, triage is a big issue in general. This became a big debate over COVID. There were definitely times when we would prioritize, let's say, using a ventilator for patients which we thought we could help recover as opposed to not. And that's a very interesting dilemma. Can you remove, let's say, a ventilator from someone in order to save someone else? And I think in extreme emergencies, you have that element of triage which comes up, but MAiD isn't a triage question. Even during COVID, no one was going to actively killing someone, right? Or giving someone a pill and say, take this, we can't heal you. So I don't think the MAiD conversation should be conflated with that. Very important, of course, triage, ethical question of triage.
Mm-hmm. Great. Are there any questions that you get on the regular when you talk about this that we haven't yet asked?
I think that the biggest thing that people say to me is don't turn halacha into public policy. Don't try to impose your halacha to someone else. And part of my argument back is that I don't actually think this is about halacha. This is, you see this issue, there are opponents to MAiD, there's, that are coming from it, not from a religious perspective at all. It's just not what they understand medicine to be, and it's not what they understand human society to be and the role of humans to be. And I think that sometimes, as Jews, we're afraid of bringing religious concepts into the public sphere. And I understand why that might be true in some cases and not always appropriate in some cases. But, a lot of times I say to people, I don't think that's illegitimate. That's if you understand the world from a religious perspective, you can bring those religious viewpoints to the table. But here's one of those cases where I don't think it's just about religion. I mean, I always wonder, if I wasn't born into an Orthodox Jewish family, would I believe this? And the answer is, I have no idea, right? None of us know. It's hard to know, right, in terms of the answer to that question. But I do think that these values are just values I find that resonate with me to be true.
Understood. Yeah. Do you have any comments on the halachic status of a gosses and whether this is helpful in this conversation? Can you just define, I did in the chat, but define from your terms what a gosses is
Yeah,
and
a
how it plays
gosses
into
is
this?
someone, it's not easy term to translate, but it's someone who's in the actively transitioning process, let's say, who's actively dying, or, and that could be a certain limited number of days, and it could be a much more extended period. And the halacha there talks about don't touch. Right? Don't touch the person at that point. You should provide, palliative measures here, but don't actively touch the person. We, at this point, leave it up to God. And I think that there's something very profound and very important related to this, precisely to this issue. Part of what it means to be human is to have a certain amount of humility at this point and say, we're going to try to do what we can, but not take the place of God and decide when the person dies. In that respect, I think, the ghostess conversation is relevant.
Thanks. I see our board chair, Lindsay Bressman, has her hand raised. Lindsay will offer you
Yeah.
the chance to say a word.
I really appreciate what you just said about that this is actually not about halacha. This is our responsibility for those of us who are professionals in this space to just hold the complexity of it. I am a Jewish chaplain who cares for no Jews. My hospital is almost entirely Christian, Muslim, or non-affiliated, and it's a question here. It's a I what I appreciate you're saying is just that it's a decision like so many other decisions our patients, our families, our communities have that are faced with making that is complex and you're providing us specifically with the halachic perspective from your role as an Orthodox rabbi, but I think what Shomer always tries to do is acknowledge that end of life is extremely emotional, philosophical, existential, complicated. And, what does it mean for those of us who work in this field just to hold that? Rabbi Brody, your voice is such a gift. You have both compassion and clarity, which is, a blessing for us to learn from. And also, you're highlighting this is not a linear black and white issue.
Yeah, I appreciate the comment and very much the kind words. And I do agree, Rabbi Melanie has the much harder job to pull this together. I mean, I can just say what I think. So, but I do want to say though, there's a very fine balance between having a lot of empathy and understanding and seeing people suffer. It's horrible seeing people suffer. I don't want to see anyone suffer, and I want to try to help them in any way I can, but to also then be able to draw a line and say, but this is not the way we should go. And I don't say that in a judgmental way. There's a difference, I think, between this is a little bit of semantics of being judgmental of someone and also saying, though, but I think there's a right and wrong. And I do think there's a right and wrong here. I don't think this is something that society should do, but that doesn't take away from the complexity of the fact of this statement. I recognize there are other arguments as well. And like many issues where I think something's right or wrong, I know other people have cogent arguments as well. And so, and it becomes particularly hard because I think ultimately most people here have shared values. We believe in life. Not everyone, but a lot of people believe in life and the sanctity of life, or however you want to call it. We believe in alleviating pain and suffering. And the question becomes is how do we balance those values? And for me, I'm going to balance the value of saying that I don't want humans being the people who take someone else's life. Right, in these types of circumstances. And I think exactly what the Reform respondents said in the 90s. I understand that other people now are taking other values and saying, oh, I get that, but we have to care about the suffering value as well. And I think I get where they're coming from. I think I do get where they're coming from, but that's not how I lay out the values and the ladder of values, I guess.
Thanks. Beautiful. Friends, we could talk about this for many hours and days. If you need support about this or any other topic, please reach out to us, hello@shomercollective.org. It is our sacred honor to be able to be in contact with you and support you in your time of need. We'll set up an appointment for a one-on-one pastoral consult. And I also want to put in a plug for Ematai's resources. It's important to recognize the availability of things like a halachic living will for a family who needs to consult an Orthodox rabbi in making their medical decisions. Ematai's resources are the best out there, and I encourage you to take a look at their website if those concerns are part of your family or community's interests. And lastly, if we're doing good work and you want to see more of it, we need your help to continue doing what we're doing. We welcome your sponsorship of upcoming programs, and we welcome your support through donations. You can click to make a donation on our website. And if you want to be in touch with me to discuss further, I welcome that. Thank you, Lindsay, for adding your voice to the conversation. Thank you so much, Rabbi Brody, for being our partner in this sacred work and being able to sit at the table together, knowing that we come from different perspectives sometimes, but at the end of the day, we're all Jews and really wanting to do right by the Jewish people. So I'm really grateful for your partnership in this work.
Likewise, and I really appreciate the opportunity to speak, and to you and to Samantha and to Lindsay and everyone here for our friendship. So thank you.